Hello, my name is Ricardo and I'll be explaining on what colon cancer is, how it negatively impacts the immune system, what is going wrong, and what is not functioning properly. In the colon, the large intestine, or the rectum, the lower part of the digestive tract. It begins as a small benign growth called polyps. The negative impact of colon cancer includes tumor evasion of the immune surveillance, which is cancer cells can develop mechanisms to evade detection and destruction by the immune system. This includes downregulating the expression of major histocompatibility complex molecules, which are essential for presenting tumor antigens to T cells. Secondly is immune suppression. Tumors can create an immunosuppressive microenvironment by secreting various cytokines and growth factors that can inhibit the activation and proliferation of immune cells. Thirdly is altered immune cell function. The presence of regulatory T cells and myeloid-derived suppressor cells in the tumor microenvironment can further inhibit the function of effector T cells. And lastly, the immunoscore and prognosis. The document mentions the immunoscore, which assesses the density of the CD3 plus and CD8 plus T cells within the tumor and its invasive margin. What is going wrong? The immune system's failure to recognize and eliminate cancer cells, combined with the tumor's ability to create an immunosuppressive environment, leads to progression of colon cancer. These dysfunctions highlight the complex interplay between cancer cells and the immune system, which is critical for understanding treatment strategies aimed at enhancing anti-tumor immunity. Colon cancer affects a variety of cell types, including malignant epithelial cells of the colon, various immune cells such as the T cells, natural killer cells, dendritic cells, myeloid-derived suppressor cells, fibroblasts, and endothelial cells. The interaction among these cells contribute to tumor growth, immune evasion, and overall tumor microenvironment. What is not working properly? Firstly, we have the cell cycle control. In normal cells, the cell cycle is tightly regulated to ensure proper growth and division. In colon cancer, mutations in genes that control the cell cycle, such as TP53, APC, and CROS, lead to uncontrolled cell proliferation and survival, allowing cancer cells to grow and divide uncontrollably. Secondly, the immunosuppressive microenvironment. Colon cancer can create an immunosuppressive microenvironment that inhibits the body's immune response against the tumor. These include the recruitment of regulatory T cells called TREGs and myeloid-derived suppressor cells, which suppress the activity of effector T cells that would normally target and destroy cancer cells.
Hi, my name is Shareya Pabon and I'll be explaining the treatments to help combat colon cancer. Next, we're going to look at the treatments and discuss the personalized therapy for early stage colon cancer, specifically the integration of biomarkers and genomic profiling. There are a few key components. First component is the ctDNA, or the circulating tumor DNA, which allows detection of residual cancer cells that could potentially resurface after surgery. It is a real-time monitoring that can guide decisions regarding the need for an intense chemotherapy. It also potentially improves outcomes for patients who would benefit treatment while sparing others from unnecessary toxicity. Next is Immunoscore, which assesses density of CD3 plus and CD8 plus T cells in tumors. It has demonstrated potential in categorizing patients into specific prognostic groups and helps identify if the patient needs more aggressive treatments and immunotherapy or not. Next would be molecular markers and genomic profiling, such as dMMR status, and mutations in KRAS and BRAF, which provides information about the tumor's biology and their response to specific therapies. One example would be dMMR tumors may not benefit from standard chemotherapy, suggesting that this type of tumor requires a different approach to treatment. And the last one would be targeted therapies and immunotherapy. So, understanding tumor biology leads to targeted therapies and immunotherapies against cancer or enhance immune response to tumors. This includes potential use of immune checkpoint inhibitors in patients with specific biomarker profiles. Next is the applications. So the first one would be ELISA, or enzyme-linked immunosorbent assay, which is used as a biomarker detection and used to quantify specific proteins such as cytokine or tumor markers in patient samples. For colon cancer, it measures levels of circulating tumor markers or immune-related proteins, aiding in assessment of tumor burden and immune response. Next is ELISpot, which is used to detect and quantify the frequency of the T cells, which produces specific cytokines in response to tumor antigens. It helps with effectiveness and immunotherapies by measuring immune response against cancer cells and also provides insights into the potential success of treatment.
The last two applications of biotech includes, firstly, the fluorescence activated cell sorting, or FACS for short. It is used for immune cell profiling and a powerful technique for analyzing and sorting immune cells based on specific surface markers. This method allows researchers to characterize the immune cell population present in the tumor microenvironment or peripheral blood, providing insights to immune cell landscape of colon cancer patients. And lastly, it's a circulating tumor DNA analysis, or ctDNA for short. It is used for monitoring treatment response. The use of ctDNA as a biomarker for minimal residual disease and treatment efficiency. Techniques for analyzing ctDNA often involve PCR-based methods, or NGS, which can detect specific mutations or alterations in the tumor DNA circulating in the bloodstream. And that concludes our presentation on colon cancer. Thank you so much for listening in.